am super excited for today's episode. We are going to be talking about how to make your Botox last longer. It's important to understand that Botox is a medicine that gradually kicks in and gradually wears off. Hi everyone, my name is Dr. Kristen Herzog, board certified nurse practitioner and injection specialist. Welcome to the Perfect Dose podcast. I am super excited for today's episode. We are going to be talking about how to make your Botox last longer. I literally get asked this question all the time, all day, every day. What can I do to make my Botox last longer? My Botox isn't lasting. Am I resistant? Is it not working anymore? I'm going to break down for you guys exactly what you can do to make your Botox last longer, ways that you can ensure that you will be poked less often in your practice. It's important to understand that Botox is a medicine that gradually kicks in and gradually wears off. So let's first start by breaking down what Botox is and how exactly it works. So Botox is a medication. It is a toxin. However, it has been studied. It is safe. There are lots of studies that show that the small, tiny amount of Botox is not leaving your muscle and it is not affecting your body systemically. So you can rest assured that getting Botox for your wrinkles is a very safe and effective treatment. How this treatment or medication works is it works by acting on the neurotransmitters that make your muscles contract. And your neurotransmitters, think of these as firing off and signaling your brain to say, okay, it's time to raise your eyebrows. It's time to frown. So when these neurotransmitters are firing off, you are able to contract your muscles. When Botox starts to kick in, it slows the release of these neurotransmitters, and then your muscle is not contracting. So how it works is it is first injected. You will start to notice an effect at around day 3 to day 5. Everybody's different. And then full results at 2 weeks. Now, 2 weeks is that peak effect. So imagine the Botox working at its strongest and best, most impactful way at week 2. So oftentimes people will feel funny. They may feel heavy at week 2. You may feel super frozen or super stuck. But by week 3, your Botox will start to feel more natural. So that is the bell curve when Botox is first at its peak effect and kicking in. So I always tell my patient, call me at week 2 and we'll know if it looks right. Call me at week 3 and we're going to know if your dose is right by how it feels. So it will look good at week 2. It will feel good by week 3. And then what's going to happen is by weeks 4 through 6, you're going to be like, oh my gosh, my face is flawless. My Botox looks amazing. I have no lines. I have no wrinkles. And then suddenly week 8 is going to roll around and you're going to notice that you're getting a little bit more movement in your forehead. By week 10, you're like, holy cow, I have lines back. I have wrinkles back. And then we retreat at week 12. So just because you aren't frozen for a full 3 months does not mean that your Botox didn't work. So many people come into my office and they're like, my Botox only lasted 2 months. It's worn off completely. Well, that's normal. It's supposed to start wearing off by 2 months. You won't be back to baseline. And what that means is if you were to take a video before you had any Botox to what you look like at week 8, you will not look the same. You may have lines and wrinkles, but they won't be as bad as they were at baseline before you had any Botox. And it's important that we don't treat at week 10. Even though we're anxious and we want to treat, we're like ready to add more Botox in our forehead because our lines are back. We need to wait until week 12. And that's because the medication needs to fully wear off. And that is going to ensure that it works the best every single time. It's just like taking an antibiotic. If you were to go to the doctor and you were sick and you took an antibiotic, you need to make sure that you take the full dose. That way it works completely. It kills all the bacteria in your body. And then it reaches its maximum potential. If you were to take your antibiotic for 2 days and then stop and then take it for another 2 days or self-dose and self-medicate, you can build up resistance. So that's something that can happen with Botox is if you don't give it time to fully wear off, it cannot work as good for you in the future. Now that you guys understand what Botox is and that it works like a bell curve, let's talk about ways to make your Botox last longer with less pokes. So number 1 is dosing. It is important that you are dosed appropriately. And the dose impacts the duration. So what that means is the higher Botox dose that you get, the longer your Botox is going to last. So if you get 5 units in your forehead, your Botox is going to last a few weeks. If you get 20 units in your forehead, your Botox is going to last a few months. Now, 5 units and 20 units impacts how long it lasts, but it does not impact how many pokes that you get. So many people are like, 20 units, is that 20 pokes? No, 20 units can be 5 pokes. Botox pokes are determined on where the peaks of your muscle are, which means where your muscles are the strongest. So typically, when I'm assessing someone's face, I will have them raise their eyebrows, I will have them frown, and I will mark on their forehead with a marker exactly where their muscles are pulling, exactly where they are the strongest, and I will put their Botox in those places. Now, whether I choose to use 5 units, 10 units, or 20 units, I will do the exact same amount of pokes. So more units does not mean more pokes. However, it's really important to understand that dose means duration because the FDA approved Botox to last for 3 months, and that dose was 64 units. 20 units in your forehead, 20 units in your frown lines, and 20 units in your crow's feet or the lines around your eyes. So if you are not getting 64 units, then your Botox is not going to last 3 months. All of the clinical trials that were done on 64 units. So oftentimes in my practice, I will start patients at a lower dose. And then it's not uncommon for us to eventually climb up in your dose in order to get you to that maximum FDA approved dose that works and that will last the longest. Okay, so dosing properly is the number one way to make sure that your Botox lasts longer. Typically, you will get Botox between 3 and 4 times a year, depending on your muscle strength, depending on the dose that you get, and depending on your metabolism. So what if you have a strong metabolism and you're like, my Botox, I get my 64 units, it's still wearing off. What can I do? Well, the one thing that you can do in order to make your Botox last longer is avoid the sun and avoid excessive heat. Now, that sounds pretty freaking impossible for those of you living in hot climates like Arizona. And there's a study that shows that being in a hot climate can actually impact how long your Botox lasts. So if you're getting dosed appropriately, and your Botox still isn't lasting, it's most likely because of excessive heat and excessive sun exposure. So if you live in these climates, my number one recommendation for you is going to be to wear an SPF is sunscreen greater than 30 so that you can maximize protection from the heat, and also to avoid hot saunas and hot yoga. And that can be really difficult. I'm somebody that loves the sauna, but excessive heat can make your Botox wear off faster. So avoid saunas, avoid hot yoga. Put on your hat and your SPF, especially if you are in these hotter climates, in order to increase the longevity of your tox. Now, the other thing that you can do, and this is really cool because studies have shown that this actually will make your Botox last longer, is taking a zinc supplement. And you might be wondering, well, why do I need to take a zinc supplement? How is that going to make Botox last longer? So Botox needs zinc in order to work. If your body doesn't have enough zinc, then the Botox can't bind to the muscle. So this is a crucial component for your Botox to work. So what I recommend my patients do is start taking a zinc supplement 5 days before your Botox treatment and 5 days after your Botox treatment. That way, we can ensure that you have enough zinc in your body when we are treating you. So Botox is being injected with enough zinc and it is kicking in when your body has enough zinc. This is going to increase your Botox longevity by about 30%, according to some studies, which is pretty freaking awesome. And it's also going to make your Botox results better because the more zinc you have, the better your Botox will be able to work. So ideally, you're going to take a zinc supplement daily. Zinc has so many other benefits, especially for your immunity, but specifically for Botox, if you take this supplement 5 days before and 5 days after your treatment, you will notice an increase in your Botox longevity. So other than staying out of the sun, avoiding hot saunas, avoiding hot yoga, wearing your SPF, and taking a zinc supplement, another hack that you can do is make sure that you're protecting your Botox investment. I always tell my patients, if you get Botox and you're spending $850 on your Botox treatment and you are not protecting your investment with a good skincare regimen, you are wasting your money. So this is another key component, you guys, to making your Botox last longer. It's taking care of your skin. So I always recommend that my patients are at least using a vitamin C serum. Vitamin C is going to protect, prevent and correct. It is a powerful antioxidant. It's also going to help protect against some of those heat rays. So you're getting like a 2-for-1 special using vitamin C with protecting against the heat and making your Botox last longer. It also stimulates collagen in your skin. The other ingredient that I highly recommend for my patients that are using Botox is to use a retinoid. Retinoids are really important for cell turnover. What that means is fresh, new baby skin. We want the quality of our skin to look amazing. So using a retinol every single night is going to help prevent that wrinkle formation. It is also going to help ensure that our cell is constantly turning over and we are seeing fresh baby skin on the outside. The other ingredient that I absolutely love is a growth factor. And growth factor is like Botox in a bottle because it literally stimulates your body's own natural collagen. It is going to help with fine lines, with wrinkles, with texture, pores, skin sagging. So if you are investing your money into Botox, you need to be using these ingredients at home, and you will notice that your Botox lasts longer because you're stimulating collagen in your skin and your skin quality is looking so much better. Now, how can we know if our Botox is actually working? Because I know we mentioned the bell curve of Botox, that Botox is going to peak, it's going to gradually wear off, things that we can do to make our Botox last longer naturally. But how do we know if our Botox worked? Because so many people will come into my office and they'll be like, I'm not frozen, my Botox didn't work. Well, the number one thing that you need to look at in order to understand if your Botox really worked is if your lines are better at rest. So if you look in the mirror and you're like, okay, I'm not frozen, I can still move my brows, but I have no lines, your Botox worked. Botox is not meant to leave you absolutely frozen, although sometimes that may happen for some patients. When they are dosed high enough in their forehead, they may lose that ability to move, but I feel like that makes you look less natural. And in my practice, I am all about natural results. So while some of you may want that frozen look and may only think that Botox is working if you're frozen, that's not true. So thanks for tuning in to today's episode. This was really fun, discussing some really cool hacks on how to make your Botox last longer. After listening, you better go get your SPF, your hat, start taking a zinc supplement, and make sure that you are being dosed appropriately. Dosing is everything. We are done with baby Botox, you guys. We are being dosed according to our muscle strength. So choose a provider that understands Botox, understands how it works, and can make sure that you are being dosed according to your strength. Thanks for tuning in to today's episode. I will see you guys next week. You can follow me on Instagram at The Perfect Dose.